Hi, my name is Dr. Cesar Fonseca, leading physician here at Beyond CellCare, and today I'm going to talk to you about neurodegenerative diseases and how stem cell therapy can benefit in them. Neurodegenerative diseases are a group of diseases that involve the affection of the brain and the spinal cord specifically. These have different causes such as environmental, genetical, and they tend to get worse over time. That's why they're chronic and degenerative. For example, Alzheimer's, Parkinson's, dementia, and other group of diseases, autoimmune diseases like multiple sclerosis that affect the brain and the spinal cord are involved and are also part of this group of diseases. Stem cell therapy for neurodegenerative diseases has the primary objective of slowing down the progression of the disease and with the opportunity to change the natural course of it, things that unfortunately not any current therapy offers. Stem cells work, as we've discussed, through cellular signaling. So we have to put the stem cells in the environment that is being affected. And while understanding the mechanisms of damage called the pathophysiology of the disease, and understanding how stem cell signals can interact and interrupt certain damage mechanisms involved in that specific diagnosis. Of course, all cases are particular. Every patient has its own particular needs. That's why we provide tailor-made therapies. Understanding the signals involved in all the therapeutic mechanisms by stem cells, we can picture how they're going to benefit in certain diseases. So the growth factors secreted will enhance and reactivate what is called neosynaptogenesis, which is overall the reconnection and rewiring of our brain tissue, and that will slow down the progression because we're fighting back or making the response of our own tissue better to the damage mechanisms. Also, the regulation of the immune system, which is the glial system in our brain, will be regulated, reducing neuroinflammation, reducing the impact of the apoptosis, the cellular death rate in the brain and in the spinal cord directly. Another mechanism involved is fibrosis. Preventing fibrotic adding leaves more room for actual functioning cells to fill that space and generate an actual regeneration rather more than a repair. All these factors together, involving even more details in them, which we can get into those in a direct consultation, will be involved changing the natural course of the disease and providing the opportunity to even reverse certain complications. Again, not all patients have this opportunity. These are personalized therapies based on each patient's clinical situation. That's why I always like to be clear with my patients about the scopes and limitations of stem cell therapy. A lot of people promise magical outcomes. This is no different than any other medical field. We will be following up objectively with the correct data, with the correct follow-ups, with clinical studies, imaging studies, to make sure that we're making progression. To learn more about the benefits of stem cell therapy in neurological disorders, please feel free to contact us through our website or social media.